Okay, so the first thing we're going to go over is what's in the kit. You're going to have a rescue breathing mask, and when you open that up, you'll see a flat mask, and you have to push it out, and the valve should be pointing out. This is the rebreathing valve, and here's the snap. You're going to have a set of latex-free gloves, and we have our own set extra in the kit. And you're going to have alcohol wipes, which you can use to remove any blood afterwards. Inside this light-proof kit, you're going to have a vial of Narcan, and the Narcan should be kept out of the light until it's ready to use. We have an atomizer, which turns it into a spray. We'll have 2 safety needles, and we have 2 TB syringes with regular needles on them. And in the real kit, you're going to have 2 bottles of Narcan. This is 0.4 milligrams of Narcan in 1 cc. So if you're prepping the kit, what you're going to do is pop the top off, remove the cap, and pull the syringe back until it goes down to the 1 cc mark. And then you put the needle in, you inject the air, turn it upside down, and remove the Narcan. And you really should be able to remove a little bit over 1 cc. And then you don't need to worry about bubbles, because we're talking about injecting it into a muscle. And you put the cap back on. This is still a sterile needle. You pull it off, and you put the atomizer on. And again, you're going to have 2 of these. If you have to use the safety needle, if you don't have an atomizer, you just take the safety needle and put it on. And we're all set.
Okay.
So we've already talked about what's in the kit. Now you find somebody unconscious, you don't think they're breathing, so the first thing you do is check a pulse on their carotid, and it's right in the same location your carotid is. And if you don't feel a pulse, then you would go ahead and start CPR, and we've got a separate video for that. If you do feel a pulse, you're going to start rescue breathing, and before this you should already have called 911 as soon as you found them. And if you can, leave them on speakerphone and keep talking to them so they can give you instructions and tell you how close they are. So we've decided we're going to do rescue breathing, so we slip the mask on. You make sure that it's tight, nose up, and you're going to do 2 rescue breaths. And the one thing you don't want to do is, if you breathe in too much air, you can actually cause a pneumothorax and collapse their lung. So you want to only do a 1-second breath, and their chest wall should only move about 1 inch. So I'm going to do 2 rescue breaths. And then I'm going to stop, and I'm going to give the Narcan. Now we already have our 2 loaded syringes. We've got our atomizer. So I'm going to pop off and put on the atomizer, and I'm going to put half the Narcan in each nostril, and then lay the syringe down. And I'm going to go back to doing rescue breaths, and it's going to be 1 breath every 10 seconds, so 6 breaths a minute. So you can count out 10, do a breath, count out 10, do a breath, and if you have somebody else, they should still be talking to 911. So after 3 minutes, they haven't regained consciousness. So we're going to give the second Narcan, and in the meantime someone has stepped on the atomizer and broken it. So we're going to use a safety needle, and you pop on the safety needle, pull off the cap, and it looks pretty much like a regular needle, and we're just going to inject right through their clothing and give them 1 cc of Narcan. And then once I've pulled the needle out, you don't want to put the cap on because you might stick yourself. So on the safety needle, I put it up here next to the shirt. What you do is you take your thumb and push the plastic guard over, and now it's capped and it's safe. And lay it down. And that's it. So EMS has come and taken the patient to the hospital. They've left everything here on the floor, and at this point, before you dispose of it, you want to put your gloves on, and these can be difficult to get on. So one thing you can do is put a little breath in it and swing it and inflate the glove, and that usually makes it easier to get out. Okay. So I put both my gloves on. I've got the mask. The mask has to be put to the side and disposed of separately, but everything else can go in this container. So I have my safety needle. Again, I don't have to worry about the tip. I take it apart, throw it away, take off the atomizer, throw it in, and any unused needles, and make sure they aren't uncapped before you touch them. Put them in, and I can even finally take off my gloves, and everything fits in here, and this has to be disposed of separately, and everything in here should be disposed of.